Today, we're getting into something really fundamental for medicine. The different ways drugs are actually given.
That's right. How a drug gets into your body.
Exactly. We've got this document outlining the main routes, and we want to unpack why picking one over another is so vital for treatment to work well and safely. Think of it as building that solid foundation.
Yeah, it's more than just getting it in. It's about getting it to the right spot, at the right speed, the right dose.
Right.
We'll follow the doc section by section, look at how each route plays out with absorption, distribution, all that.
Sounds good. So let's kick off with the most common one, probably. Oral administration.
Yeah.
You know, pills, capsules. What makes this the go-to based on our material?
Well, the big plus is convenience, isn't it?
Okay.
Easy for you to take yourself, generally safe, non-invasive. Plus, it tends to be cheaper.
And lots of different formulations available too, right? Tablets, liquid.
Exactly. Loads of flexibility for using it at home without needing, like, a nurse right there.
Okay, makes sense for your everyday medications. But what are the catches, the downsides?
The document points out that absorption can be really variable. It changes person to person, depends on your gut, what you've eaten.
Oh, okay.
And then there's a first pass effect. After it's absorbed, it goes straight to the liver, and a chunk of the drug can get broken down before it even does anything.
So less drug actually reaches the rest of the body?
Precisely. It also just doesn't work if someone can't swallow, obviously. And it's generally slower acting than, say, an injection. Plus, some drugs can be rough on the stomach.
Right. So simple isn't always best or fastest.
Okay.
What if you do need that speed, like in an emergency? That leads us to intravenous and fee.
Phe is the speed king. Drug goes straight into the vein, into the bloodstream, boom.
Instantaneous almost.
Pretty much. Our source stresses the precise control this gives doctors over the dose. You know exactly how much is getting in second by second.
Useful for drugs that might irritate tissues otherwise.
Definitely. And you can give large volumes if needed. It's tailor-made for those urgent situations.
But putting something directly into a vein, that sounds like it carries some risks.
Oh, absolutely. It's invasive, so there's always a risk of infection. It costs more. You need trained staff, sterile conditions.
Makes sense.
And because it's so direct and fast, the risk of getting too much, an overdose, is higher if you're not careful. Plus, the vein itself can get irritated or inflamed. That's phlebitis.
Okay, let's move to another injection type. Intramuscular, IM, like a vaccine shot in the arm. What's the story there?
IM gives you a sort of intermediate absorption rate, not as fast as IV, usually faster than oral.
Okay.
And the document mentions these things called depot formulations. Basically, the drug is designed to be released really slowly from the muscle over weeks or months sometimes.
Oh, interesting. For long-term stuff.
Exactly. Good for some long-acting hormone therapies, certain psychiatric meds, and of course, many vaccines. It can cover both fairly quick needs and those longer-term treatments.
But it can hurt, right?
Yeah.
What are the downsides?
Yeah. Pain at the site is common. You're also limited in how much liquid you can actually inject into one spot.
Right. Can't put a huge volume in a muscle?
No. And while it's not common, if it's not done right, there's a small risk of hitting a nerve. Plus, how fast it's absorbed can depend on the blood flow to that particular muscle.
Gotcha. Okay, next up, subcutaneous. That's just under the skin, yeah. Like insulin shots.
Correct. Just into the fatty tissue layer.
Ah,
A big advantage highlighted here is that it's often easy enough for people to do themselves.
crucial for something like diabetes management.
Absolutely. And like IM, it can be used for sustained release drugs. The risk of infection is generally lower than with IV too. So yeah, good for long-term therapies where you don't need that immediate high concentration.
What are the limitations then for subcutaneous?
Similar to IM, you can't inject large volumes. Absorption rate can still vary a bit, and you might get some local irritation.
Okay.
Things like skin temperature can even affect how quickly the drug gets picked up. And if you inject in the exact same spot repeatedly, you can sometimes get this thing called lipoatrophy, where the fat tissue breaks down.
Right. Need to rotate sites. Okay, now for something different. Inhalation. Asthma inhalers are the classic example. How does that work so fast?
Well, you're delivering the drug straight to the lungs. Huge surface area, lots of blood vessels. It gets absorbed very quickly.
Directly where it's often needed for breathing problems.
Exactly. Targeted delivery. That usually means fewer side effects elsewhere in the body compared to, say, taking a pill. Our source mentions it's good for local stuff like asthma, but also some systemic drugs like certain anesthetics, great for quick relief.
But getting the technique right with an inhaler, that seems key.
It's absolutely critical. If you don't use it properly, the drug might just end up in your mouth or throat, not the lungs.
Doesn't do much good there.
No, really.
Got it
And it's
right.
mainly for drugs targeting the respiratory system. Plus, some people might react with bronchospasm, their airways actually tighten up, and the effect might not last super long.
Okay, let's shift gears to the skin again, but differently. Topical administration, creams, ointments,
Yeah, applying directly onto the skin surface. The big benefit is a localized effect. You treat the problem right where it is a rash, some pain.
and fewer side effects systemically, I guess.
So much fewer, usually, because very little gets into the bloodstream. It's easy, non-invasive. Some topicals, like patches, can offer sustained release, too.
So great for skin issues,
Yeah.
but not for, like, a systemic infection.
Generally, no. The document makes that clear limited absorption means it's not suitable if you need the drug circulating throughout your body, and you can still get local skin irritation or allergies. Plus, the condition of your skin matters, and you might need to reapply it often.
Makes sense.
Oh,
Okay, last one. Transdermal, also on the skin, but different from topical,
Yeah.
right? Like nicotine patches.
right. Transdermal patches are designed specifically to deliver the drug through the skin and into the bloodstream over a longer period.
Ah, so it is meant to get systemic.
Exactly. It provides sustained release, which means more consistent drug levels, potentially fewer ups and downs. It's convenient, non-invasive, and importantly, it bypasses that first-pass liver metabolism we talked about with oral drugs.
Oh, right, so potentially more predictable dosing.
Yes, potentially.
What are the limitations for patches?
Well, our source notes, it really only works well for certain types of drugs, usually small molecules that can actually get through the skin barrier effectively.
Not everything can soak through.
No. And you can still get skin reactions where the patch is. There's also usually a delay before it starts working because the drug has to penetrate the skin layers first. And you need healthy, intact skin. It's not for every drug or situation, especially if you need fast action.
Wow, okay, so we've covered quite a range there. It's really clear that how you give a drug isn't just a minor detail, it fundamentally changes how it works.
Absolutely. Each route has this unique profile of advantages and disadvantages. Choosing the right one is, well, a really critical piece of the puzzle in pharmacotherapy. It impacts effectiveness, safety, patient adherence, everything.
It's a balancing act based on the drug, the patient, the condition. It
Mhm.
really underscores how much thought goes into deciding between, say, a pill versus an injection versus a patch in different clinical scenarios. That's definitely something worth mulling over further.